Good morning to our viewing and listening audience. Welcome once again to today's COVID-19 update for today, Tuesday, December 28th, 2021. The Minister of Health, Dr. Frank Anthony, is with us once again, and we will be talking about some things that um, we deem pertinent and we'd want to be answered by the Minister of Health. Minister, good morning.
Good morning.
Thank you for joining us once again. Let's begin with our current hospitalization and our active cases.
Well, thank you very much for having me. Um, I hope people had a very safe Christmas and Boxing Day holidays. Um, but nevertheless, COVID is not taking a rest, and we all have to protect ourselves. We have currently 741 active cases across Guyana. And of those cases, we have 32 persons who are currently in a hospital, with 22 of them being at the Ocean View Hospital. And of the persons hospitalized at Ocean View, we have 7 of them in the ICU. Currently, overall, we have 17 patients that require oxygen, so it shows that they still have a severe form of COVID, and we all have to be taking the precautions.
It has been reported in some sectors of society that a number of young boys have died as a result of the COVID-19 pandemic, as opposed to the girls that would have died. Can you give us some information in terms of this?
So if we go back and look at the 1,050 deaths, we would have had 571 of those deaths being males. So that represents 54.4%. And we would have had 479 deaths for females. So that's 45.6%. So there's a trend where we are seeing more deaths in males, and I'm not surprised that for the pediatric cases, males might account for a slightly higher number. In the pediatric group, most of the patients who have died, again, had varying comorbidities, including we had a few cases of children that had different forms of cancer. So these children on their own, without COVID, had a very bad prognosis, and this was just compounded by COVID, and therefore we would have seen these deaths occurring.
So, Minister, we can conclude then that COVID-19 has no gender bias, and this slight increase in boys is nothing to do with gender.
Well, that might be true, but we have also seen with the adult population, males tend to be more outgoing, and they are involved more in practices that can put them at risk. So because of this high-risk behavior of not wearing masks, being in close proximity with possibly persons who are infected with COVID, I would want to believe that we'll see a high amount of cases among young men. And we would obviously, if we're getting more cases among this group of people, then ultimately we'll see more deaths because of the amount of cases. So that's something that we have to look at. Risk behavior can contribute to getting the cases and, of course, resulting in hospitalization and deaths.
Minister, final question. The COVID-19 task force has been doing an amazing job as it relates to clamping down on parties and very large gatherings that have not received approval of the same. But to some extent, there are some of those parties and other gatherings that may have slipped under the radar. And we have seen reports of a few parties that have had a lot of people there. What can we expect the health situation to be over the next few days or weeks?
So a couple of things here. One, COVID is spread by people's behavior. So if people are not adopting safe behavior, they can get sick. They get sick Some of them might have the milder form of the disease, but there are many others who might end up in the hospital and die from COVID. So different individuals would have different vulnerabilities, and we can't say, well, this person would get a mild form and that one would get a severe form. And that is why everybody needs to really protect themselves. So that's one of the things that we have to understand. If you are going to play hide and seek and you know, have parties because you think that's the right thing to do, you might get away with it because the task force cannot monitor everything. But think about this. You're putting yourself, you're putting your friends, your family in danger of getting a deadly disease. And is that really necessary? And therefore, if you reflect on your behavior, you would know that that's not the right thing to do. And once you can do the right thing by avoiding these situations, then it would be helpful to us. During this season, as we have said before, the task force is going to be extra vigilant, and they were able to contain some of the Christmas gatherings and Boxing Day gatherings, and we'll continue to do so during the festive season. Again, you know, we want to keep people safe. It's not that we want to be a party Grinch, but we really want to keep people safe. And the only way we can do that is to restrict how many people can be in a gathering, and preferably we'll want to see that people are fully vaccinated and so forth. So as we go forward, I really want to appeal to people to really take these things into consideration. Be vaccinated, get your booster, you know, keep social distancing, stay away from crowds. You can avoid going to the parties, you can avoid going to these large social gatherings, and that would help us tremendously.
For more information, visit our website at dpi.gov.gy or any of our social media platforms. For DPI, I am Shukwan Gill.